April is Autism Awareness Month. This morning we have two special guests from Springhill Medical Center's Rehabilitation Institute. Good morning, ladies.
Good morning.
This is Amy Russell and this is Katie Wyatt Bufford. You treat people of all ages at Springhill Medical Center, but you want to talk to us about the pediatrics program. Let's start with that.
Yes, the pediatric program has become especially important because with autism, there is such an important focus on early intervention, and the reason is because now typically they're diagnosing autism around 18 months. So that means that by the time a child gets to 2, they've already missed some potentially important rehab that they could have received. So we really want parents, daycare professionals, anyone who is around a child to become aware with the red flags of autism. You know, are they playing with other kids? Are they alone in a corner and, you know, not wanting to interact with someone? Do they have difficulty with emotional regularity? Are they, when they get upset, is it for, what seems like an unreasonable length of time? All of these red flags are really important to flagging and bringing it to the attention of the pediatrician.
So say someone brings a child to your attention, then you're a speech therapist, you're an occupational therapist. How do these things work together? Are they individualized, or do you work together, in fact?
We do work together. We have individual evaluations. As soon as a child comes in, we take the child back and do an occupational therapy eval, and then she'll do a separate speech and language evaluation. Occupational therapy focuses on the self-help skills of the child able to get themselves dressed, get themselves bathed, brush their teeth without any difficulty. Also play skills. How are they interacting with other children? Are they playing with their toys appropriately, or if they're just spinning the wheels on tires of a truck? There's a few examples. They also focus on school-related skills, on their handwriting, on scissor cutting, all the things that encompasses a child's occupation. That's what we focus on.
Yeah. So when you're working with these students and these children, is it amazing to see some of the success, the progress that they make as they go through these steps?
It is, and we really break it down, especially in speech therapy, receptively how much a child is understanding, and that can be, do they understand that a shoe is a shoe, and then you move up to pictures. So you see progress rather quickly because it's each step is very small. You master it and then you move on. And we also do, of course, the expressive communication, which when people think of speech pathologists, they think of talking, and it's hard, but parents need to understand that before you can talk, you have to receptively be able to understand the language, and if you don't, then you're not ever going to produce it. So we help get those, what we call pre-linguistic skills, and we help lay the groundwork for later communication.
So if someone's watching at home right now and they're seeing some of these red flags, which you mentioned earlier, what should they do? How do they get involved with you guys? How do they get their child to come see you?
Yeah. The first things first is if you're seeing the red flags, any kind of strange, untypical behaviors, the first thing that you want to do is contact your pediatrician. Sometimes the pediatrician will say to wait it out, or might even refer to a specialist. We have several specialists in Mobile that deal primarily with autism. In either case, to get an occupational therapy, a speech therapy, or a physical therapy evaluation, they have to have a referral from the doctor. So as soon as we get the referral from the doctor, then we make an appointment and set up for evaluation and then treatment.
We'll have more information up on our website. Just click on the Studio 10 tab on fox10tv.com. Katie and Amy from Springhill Medical Center, thank you very much for joining us here on Studio 10.
Thank you for having us.